Now, what is dementia?
So dementia would be a term that we use when there is day-to-day function that gets impaired as a result of cognitive impairment.
Okay.
So when people who have cognitive impairments such as memory loss start to have difficulty in their day-to-day functioning, we term that condition dementia.
What does early stage dementia look like?
In the early stages of dementia, a person usually will have some cognitive changes, which presents as, most commonly, as memory problems. So they may have difficulty with short-term memory, so they may have difficulty recalling what happened during the day or the day before. They have difficulty recalling conversations. They may forget people having visited them recently. Mm-hmm. Along with memory problems, they may develop problems in the area of language. So they may start having difficulty finding words. They may leave their sentences incomplete. They may forget names. Mm-hmm. They may have some difficulty recognizing people that they should, like neighbors and extended family, etc. They often will develop some problems with what we call executive function, and that's the ability to plan and organize their life. And that's usually reflected in their now inability to maybe do complex activities such as plan a vacation, plan a large meal. Mm-hmm. They may have start having some difficulty with higher function, such as managing the more complicated money transactions. Mm-hmm. Right? They may have difficulty managing their medications, recognizing when they're running out, when do they need to make a doctor's appointment, etc. Sometimes people get lost. They don't know where they are in the space around them, so they get turned around easily. Mm-hmm. So in parking lots and shopping malls. Yeah. So those would be some of the hallmarks of early stages of dementia.
So what is the difference between Alzheimer's and dementia?
Alzheimer's is a type of dementia.
Okay.
So it's a particular illness that affects the brain and gives rise to dementia. So there are many types of dementia. Alzheimer's is the most common form of dementia. Okay. So Alzheimer's is considered a type of dementia. And there are many of the other types. I can give you some examples. Another very common type of dementia is called vascular dementia. And this is because of vascular changes to the brain, while Alzheimer's is a degenerative problem. Yeah. Sometimes the two occur together, and we call that mixed dementia. And then there are some rarer forms of dementia. You can get a dementia called frontal lobe dementia that primarily, it's also a degenerative disorder, and it affects primarily the frontal lobes of the brain. So it gives, the dementia has a typical picture to it. So there are dementias related with different diseases, such as you can get dementias with Parkinson's disease. There is another degenerative dementia called Lewy body dementia. These are the 5 most common types of dementia. However, Alzheimer's is by far the commonest and has gotten the most attention of all the dementias.
Thank you. That really helps me understand the difference between age-related memory loss and dementia. Thank you so much, Jasneet.